Do patients with scoliosis have chronic pain? And is it treatable? No two cases of scoliosis are the same. The symptoms one patient experiences with scoliosis isn't always an indicative of what another patient would experience with scoliosis. Scoliosis is very highly variable, ranging from very mild cases to moderate cases to very severe scoliosis. And the severity is definitely classified by the size of the curvature, not the effect. So somebody could have a mild scoliosis with severe effects, and somebody could have severe scoliosis with a mild effect. We definitely know that scoliosis is more painful for adults than it is for children, because scoliosis doesn't become a compressive condition until a patient with scoliosis has reached skeletal maturity, because at this stage is when curves start to compress in the adult form. Now, compression is when there's uneven pressure that's associated to the spine, and this uneven pressure induces uneven forces to the spine, surrounding tissues, and body. Compression is the main cause of scoliosis-related pain. Children that are still growing, that are constantly lengthening and growing in an upward motion, it counteracts this compressive force, and they adapt and they grow around the scoliosis, I would like to say. Now, unfortunately, this growth can be one of the main reasons why curves progress and become larger, but they normally don't feel it. They can't say, hey, my curve is getting bigger because I'm in more pain. Normally, it's only what you see. So childhood scoliosis commonly is not painful. They don't experience pain at all. In fact, we think it's less than 5% of kids experience any kind of discomfort or pain as a result of their scoliosis, no matter what size the curve becomes. The biggest curve I've ever seen in a child has been 155 degrees. Very, very severe case of scoliosis. That child had no pain, no discomfort at all. Now, scoliosis pain, unfortunately, can involve many different areas, because the scoliosis can affect not only anywhere in the entire spine, but once you start affecting the spine, you start affecting nerves that exit into the body, and we start affecting extremities as well. So it can involve muscle, back pain, or nerve pain. The pain can radiate into extremities as a result of nerve compression. And this is one of the main symptoms that adult patients find out they have scoliosis or start seeking treatment for their scoliosis, is this nerve type of pain. Scoliosis pain, like I mentioned, can be very mild, can be intermittent, can be very chronic, can be very debilitating, and it's not necessarily associated with the size. It's associated with what happens in the adult form. Chronic scoliosis cases is definitely associated more with age group, meaning that as a patient gets older and the curve changes more, the amount of change that occurs from childhood to the adult form, that degree of change in the adult form is indicative of how much pain they're going to be experiencing. So normally as patients get into the older age group, I would say somewhere post 45, 50, 55, they're more likely to experience pain as a result of their scoliosis. Now, the lack of pain in childhood scoliosis makes it very difficult to detect. In fact, a lot of patients in adolescence may never get diagnosed because they don't have any discomfort. The curve doesn't become big enough to be seen or diagnosed. And then they go into the adult form. And then in the adult form, they're unaware that they have adolescent scoliosis, but the spine starts compressing and they start experiencing pain and symptoms in the adult form. They get an x-ray and now they're told they have scoliosis, and they didn't even know they had it. And unfortunately, as the curve worsens in the adult form, the amount of pain that you feel can worsen with it, particularly if it's left untreated and it's left to continue to progress. Because we know scoliosis is a progressive condition in any age. And if it's already worsening, it's more likely to continue to worsen, and it's more likely to cause the effects that you're experiencing to worsen with it. Now, the size of curvature, as it increases, it becomes more and more difficult to treat. So therefore, we recommend treating a scoliosis as quickly as you find the scoliosis, because scoliosis pain is a symptom associated with the scoliosis. And therefore, addressing and treating the underlying cause is by far, I think, the most important method in trying to manage a patient with scoliosis. Now, unfortunately, most patients with scoliosis are treated like typical back pain patients, meaning they could have a significant curvature going on and they could be addressed. But if the curve is not considered surgical, most medical providers, orthopedic doctors, would discount the scoliosis and normally just treat the symptoms by providing pain medications, maybe giving injections, and these normally apply only kind of short-term relief while the curve is left alone. And while the curve is left alone, the curve is still worsening in the adult form as a result of compression over time, and therefore it just kind of kicks the can down the road to now later on you have a bigger curve and worse problems. for real long-term improvement, really the treatment of scoliosis needs to affect the condition itself, meaning it needs to affect the structure of the scoliosis directly. And since scoliosis has a structural effect to the spine, reducing the size of the curvature should be the number one focus of a patient with scoliosis. But in traditional orthopedic management, most adult patients that are experiencing pain as a result of scoliosis, the curve itself is left untreated until it becomes severe enough to consider surgery. And that's normally when curves start breaking 50 or 60 degrees in the adult form. And simultaneously, the person needs to be in debilitating pain, meaning if you're having mild or moderate pain or intermittent pain, they're not going to treat the scoliosis orthopedically because the treatment requires very invasive types of treatment like spinal fusion, which we'll discuss in a second. Now, the good thing about conservative treatment or non-surgical treatment, we can work earlier because our treatment is not invasive, meaning we can work on treating the size of scoliosis at an earlier level because we're not putting rods and screws in your spine. And non-surgical treatment normally involves using chiropractic care to reducing the size of curve with different types of adjustments and variety of techniques. Physical therapy like traction and rehabilitation and vibration therapy can be provided to help improve the size of the scoliosis structurally. We can also use exercises to help balance muscles and tissues, and we can also use home therapy and rehabilitation to help address the structural approaches to scoliosis. And the really reason we want to do this is because we're trying to treat curves at a smaller size, reduce the size of curvature to start affecting what's causing the symptoms associated with the scoliosis. Like I mentioned, left untreated, the curve continues to worsen, the problems become big enough, and now at some point you may be considered to be a patient or a candidate for spinal fusion and surgery, which in the adult patient has more risk than an adolescent patient and can lead to negative effects. So the best way to minimize the effects of scoliosis, including pain, is to treat it as proactively as possible. And conservative treatment that's started as soon as it's found typically has the best chance of reducing the size of curve and improving it. Now, most adults, they may have had scoliosis a very long time and not experience their pain until they're in their older stage of life, 40, 50, 60 years of age. As soon as you start experiencing pain as a result of the scoliosis, the sooner you start reducing it, the less likely this pain is going to continue to progress and start limiting your function in normal life. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.